Great. It's noon, so I think we can go ahead and get started. Thank you everyone for coming. My name is Zena, and I'm a program supervisor with NYU Langone's Alzheimer's Disease Research Center, or ADRC. Welcome to the Learn at Home on Stress, Cognition, and Mindfulness. Our speaker today is Dr. Tanya Spruill. She is an associate professor in the Department of Population Health and Medicine. She's a clinical psychologist and behavioral scientist whose research focuses on the adverse health effects of chronic stress and related psychosocial factors. With funding from the NIH, CDC, and American Heart Association, she's conducting clinical trials and testing mindfulness interventions in patients with hypertension, cardiovascular disease, and neurological disorders. Again, thank you everyone for being here. You will be unmuted at the end of the presentation for questions, and feel free to put questions in the chat box as things come up.
Great. Thanks, Zena, and thanks everyone for joining. Zena, if you see questions in the chat that I should address kind of in the moment, please let me know because I don't believe I can see them with this view.
Sounds good.
So to get started, there we go. Just wanted to note, actually, Zena already noted my disclosures, research funding from the NIH, CDC, and the American Heart Association. So I wanted to start with just a quick outline of what we'll be covering today. We're going to start with what sounds like a simple question, what is stress? But you'll see it's not quite so simple. We'll talk a little bit about how stress affects the body and the brain. And then we'll move into mindfulness and get into kind of what exactly it is and whether mindfulness interventions or programs can improve cognition. So starting with this seemingly simple question, what is stress? The simple answer is there's no standard definition. Stress means different things to different people, and we all talk about it differently and study it differently. But these are some common ways that we kind of conceptualize stress. Probably the most common is stressful events. And these are some examples of things I'm sure many people have experienced. So acute stress is something short-term, time limited in the moment. Having an argument, being stuck in traffic, things like that. There's also chronic stressors. So these are things that persist over time. They're more pervasive, sometimes more severe, and they can affect any number of domains of your life. So difficult relationships, work-related stress, financial stress, having a chronic illness. Typically, we use 6 months or so as a cutoff between considering something chronic stress or not. But again, it's not standardized. So it's really kind of an individual thing. And then the last group might surprise you. You can see this is a list of positive events. And so that's true. Even positive events can cause stress reactions in the body. So things like graduation, going on vacation, getting married, having a child. If you've experienced these things, you might be able to relate to that idea that even when it's something good, there can be an impact on the mind and the body. So the second way we think about stress is about the perception of stress. And this gets at the idea that the same event doesn't necessarily affect people in the same way. People have different reactions. So perceived stress is trying to get at this subjective feeling of being overwhelmed and really unable to cope with things going on in your life. I'm showing this measure, which is called the perceived stress scale, because it's the most commonly used measure of stress in the scientific literature. And there are several different versions with different numbers of items. This one is used most often. What's really interesting is that the answers to these 4 questions are associated with a whole host of negative health outcomes, some of which you'll see later. And so I included the scoring, the numbers for each of the questions in case you feel like testing yourself. And a score of 6 or higher is considered moderate or high stress. And that is associated with some of the negative outcomes I'll talk about. This slide is really getting at the idea that I mentioned that different people react to the same events differently. There is a distinction between the event itself and somebody's reaction to the event. And so this cluster of factors, thoughts, emotions or feelings, behaviors and sensations, These are things that occur in response to a stressful event, or an event that is interpreted as stressful, but they're not necessarily the same thing. The other final classification that I wanted to talk briefly about was mood and the emotional reactions. So people will often feel some of these symptoms. This slide is showing some common symptoms of anxiety in those different domains. So thoughts, feelings, physical sensations, and behaviors. And people will often feel some of these things and call that stress. So I feel, I'm aware that my heart is racing, and I have shortness of breath, so I feel stressed. But again, I'm trying to draw the distinction between the event itself and the reaction. And that's because we can't always control the events. We can't change them or avoid them or reduce them. Sometimes we can, but often we can't. What I hope you'll come to learn in this talk is that we can learn to change the reactions and the responses to stress. So again, these are symptoms of anxiety. These are symptoms of depression. You'll see that there is some overlap, and that's to be expected. Depression and anxiety commonly co-occur, and they are both related to chronic stress. So people experiencing chronic stress are more likely to develop anxiety or depressive disorders. And they are all, again, related to health outcomes. So I thought I'd spend a couple minutes just talking about stress in this country and kind of what's going on in the world around us. There is this really neat survey that's been in place since 2007. The American Psychological Association commissioned what they call the Stress in America survey. And so it goes through attitudes and perceptions of stress, the leading sources of stress in different groups, so overall, by age, that kind of thing. And then some of the impact that stress has on behaviors and on physical outcomes. So the most recent survey was just conducted a couple months ago in August of 2023. And this included more than 3,000 adults, so ages 18 and over, living in the US, and it was a nationally representative sample. To increase the diversity of the group, they oversampled some racial and ethnic minority groups. And they also conducted the survey in both English and Spanish. So one of the main findings was that about a quarter of adults rated their average stress level in the last year between 8 and 10 on a scale of 1 to 10, where 1 is little to no stress and 10 is a great deal of stress. This is up from 19% in 2019, which is pre-pandemic, obviously, and that shouldn't be a surprise. Whoops, there we go. There's some interesting findings by age group. So we'll see in this chart, the people aged 35 to 44 had the largest increase in stress from 2019 to this current year. So from 21 to 30%, 31%. But it's the youngest age group that actually has the highest overall level of stress. As far as sources of stress, this chart is in response to a question where people are asked to rate the top 2 sources of stress in their life. And you can see that 65% of people rated health-related stress as one of the top 2. And under that general umbrella, there's physical health, health problems affecting one's family, and mental health. If you go down the list, you can see a whole bunch of other things that I'm sure are stressing all of us out in various ways. But I wanted to show mental health quickly, given the focus of the talk here. They found that about 37% of adults reported having a diagnosed mental health condition that, just like stress, was also increased from pre-pandemic. And similarly, you can see the largest increase in that 35 to 44 age group, from 31 to 45%. But there's also an increase in the 45 to 64 age group, which is substantial. and the highest overall level in the younger adults aged 18 to 34. Some of the most interesting questions to me in the survey were about how people are coping with stress. They found 2/3 of adults said their problems aren't bad enough to be stressed about it because they know other people have it worse. That's kind of concerning to me as a psychologist, because I think, one thing we tell people is that it's not a contest. And just because there are other bad things going on doesn't mean that your experience isn't valid. So, people tend to be discounting their problems and their stress. They said almost half of the respondents said they wish they had someone to help manage their stress. 62% reported they don't talk about their stress because they don't want to burden others. And 66% said they could have used more emotional support than they received in the past year. So it doesn't sound like, in general, we're doing a great job coping with stress, I would say. This was an interesting set of findings about the older adult age group. They were most likely to report, compared to these other age groups, that they could get things done even when they're feeling stressed, to say that when they feel stressed, they can get over it quickly. And so, the interpretation was that this tendency to push through stress could again be a result of downplaying the stress. They were most likely to respond to yes to that question about their problems not being bad enough to be stressed about because other people have it worse. And so again, I think this is a concern because it seems like older people are downplaying their stress, and that mentality may deter people from getting help or seeking help when they need it. There were also some gender differences that may not surprise you. Women continue, because this is compared to previous surveys, to report higher stress levels than men overall, and were more likely to say they could have used more emotional support than they received. They were also more likely than men to cite family responsibilities and relationships as key stressors, and to report feeling consumed by their worries about money. In terms of behavioral effects, one thing to point out is the first one on the list here. So almost 1/3 of people noted that they had skipped exercising or physical activity because of stress in the past month. And then many of the other items on the list are interpersonal, some negative interpersonal interactions that resulted from feeling stressed. And then physical effects. Here, people could report multiple physical symptoms related to stress. 74% of people said that they had at least one of these in response to stress in the last month. The most common being headache, feeling nervous or anxious, fatigue, and feeling depressed or sad. So again, bringing that back to the relationship between stress and mood, we can see that here. And this is really consistent with what we know about the effects of stress on the body. You may have heard about kind of the fight or flight response, and that's basically when the body perceives a stressor or a threat. It activates the sympathetic nervous system to basically prepare the person or the body to respond to the stressor, to either fight or flee. And so that set of reactions that happens in the body can lead to effects on a whole variety of systems. So lack of concentration, you can see like the cognitive effects, and emotional, heart rate and blood pressure, gastrointestinal effects, immune suppression, joint pain, bone density effects, and decreased hormone production. And again, I think I mentioned, everybody experiences stress. And so these effects in the acute sense are normal, and sometimes, certainly adaptive, but sometimes, in terms of cognitive function, can even increase performance. A certain amount of stress is good. But over time, chronic stress, which is severe or persists for long periods of time, has been shown to increase the risk of these and many other chronic illnesses. And so that's kind of where we're going to go. This is one example. I chose this one because it uses that perceived stress scale that I showed earlier. And here is an example of when a score of 6 or more is associated with a serious health outcome. So this is a study that looked at more than 4,000 heart attack patients from 24 different hospitals across the US. And they found that people who scored a 6 or higher on that stress measure were 42% more likely to die within 2 years of their heart attack than people who scored under 6. That's a highly statistically significant effect, and just one of many examples of the relationship between stress and health outcomes. So then, to really get into the meat of this talk, I wanted to move into some results related to cognitive outcomes. This first one here is concerned with acute effects of stress. And so I think this is probably, kind of common knowledge. People are aware that acute stress can affect cognitive performance in the moment. But this was a really interesting study that demonstrated it. So they enrolled 333 older adults and had them complete daily diaries for 8 days. And so each day they would rate stressful events that had happened that day. There's a long list of possible events, and they could write in anything else. And then they also reported every day what they called memory failures in the past 24 hours. These are just some of the examples, but there were more. Things like, did you go back to check whether you had done something that you meant to do? Did you start reading something, a book or a magazine, without realizing you already read it? Did you have trouble finding a word, feeling it's on the tip of your tongue? Things like that. And so what they found was that on days when people reported experiencing more stressors, they were much more likely to report memory failures. Interestingly, stressors were also associated with more memory failures the next day. There's also several studies that have shown the impact of stress on the rate of cognitive decline over time. So this was a much larger study, the Chicago Health and Aging Project, more than 6,000 Black and white older adults who completed a different version of that stress scale, a 6-item version, and had cognitive function measured using a combination of 4 cognitive tests. And they found that elevated scores on the PSS-6 were associated with lower cognitive function at baseline, and also with a faster rate of cognitive decline over 7 years of follow-up. So that's pretty impressive that, a baseline stress score has these long-term associations. Similarly, this study called the Minority Aging Research Study, which included almost 500 older Black adults, found that the higher PSS-4 scores were related to faster declines in global cognition, episodic memory, and visuospatial ability. The figure on the right is showing the global cognition scores, and you can see the blue line is the higher stress group, and the green line on top is the lower stress group. And you can see how the global cognition scores decline at a much faster rate over the study year, which is shown on the bottom in that high stress group. There's also evidence that stress increases the risk of incident cognitive impairment. The REGARD study included more than 24,000 Black and white adults, slightly younger age group, so starting at 45. And they completed that PSS-4 measure at baseline and at an 11-year follow-up visit. Cognitive impairment was assessed by a measure called the 6-item screener. So this is derived from the mini mental state exam intended to detect cognitive impairment. And they found that high versus low stress, using that same cutoff, was associated with cognitive impairment at baseline. And that is shown on the table on the bottom left. I just highlighted, there's a lot of numbers here, highlighted the things to pay attention to. So the 1.57 number is showing that people with high stress scores had a 57% greater odds of having cognitive impairment at baseline than those with low stress. And that was controlling for a bunch of demographic factors, comorbidities, hypertension, diabetes, cholesterol, and also lifestyle factors. So exercise, body mass index, smoking, and alcohol. When they controlled for depression, that effect became smaller. And that, again, that makes sense. Depression and stress are so closely related, but it was still a significant effect. There was still a 37% greater odds associated with stress for baseline cognitive impairment. They also found that change in stress over time was associated with incident cognitive impairment. And so here I've highlighted, again, what I think you should pay attention to. They looked at it a few different ways, but this is showing that people with new or persistent stress between the baseline and 11-year follow-up had 39% higher odds of developing incident cognitive impairment than those with either low or decreasing stress over time. Here is yet another study. I think this might be the last one. The Einstein Aging Study. So this was a community-based sample of 507 older adults in the Bronx, and they found that higher PSS scores here, the cutoff is different because it's one of the longer versions, was associated with a 30% greater risk of developing mild cognitive impairment. And again, this was independent of important covariates that could have affected the incidence of MCI. This was a recently published study just earlier this year, a longitudinal cohort study of more than 1 million Swedish adults. And they used administrative healthcare databases to test the association between a diagnosis of chronic stress and or depression and incidence of mild cognitive impairment or Alzheimer's disease some number of years later, and that follow-up period varied. Again, controlling for key covariates. And what you see here in the table below is the relationship between chronic stress with MCI and AD, depression with those two outcomes, and then both. So all of these results, all of these effects are statistically significant and, probably clinically meaningful. So people with chronic stress alone have almost double the risk of developing MCI and more than twice the risk of developing Alzheimer's disease. And you can see that having both stress and depression is clearly the worst. There's also some small studies. I just selected one as an example, but there are some studies showing effects of stress and brain volume. This is the same Einstein aging study I showed in an earlier slide, where people completed the PSS-14 and MRIs, and they found that higher PSS scores, higher perceived stress, was associated with smaller hippocampal volumes, total and some specific subfields, and that was controlling for total brain volume, depression, and some other covariates. You can see in that scatter plot on the left that as the perceived stress scale, which is on the bottom, increases, the total hippocampal volume decreases, and that is a statistically significant effect. So, I think hopefully you're convinced that there are some real physical impacts of chronic stress. And so the question most people ask is, how does that happen? What is the pathway or the mechanism by which stress gets under the skin? So here's kind of a schematic to walk us through it. We have the external stressors. We talked about these can be major, minor, life events, chronic stressors. And those may contribute to perceived stress, this subjective feeling. And it's the perception of stress that then triggers this cycle of stress responses. So the emotional effects, anxiety and depression, physiological effects, high blood pressure, we haven't talked about that yet, and inflammation, and behavioral effects, poor diet and sleep problems. And these all kind of sustain each other. And it is those effects that ultimately lead to the negative health outcomes. whether it's cognitive impairment, heart disease, mortality, quality of life. Those are all resulting from the perception of stress. So again, it's this connection between the event and the response to the event. And distinguishing between the stressful event is important because it gives us an opportunity to think about how we intervene. So how can we break the link between a quote event, a stressful event, and then the perception of stress? So this is one way. This is hopefully not going to be too confusing here. One of the physical effects we saw of stress on the earlier figure was effects on blood pressure. So the red part of this figure is showing the blood pressure elevation that happens when somebody is exposed to stress. So that's while a stressful, say an argument is happening, your blood pressure will increase. And then it takes some time for your blood pressure to kind of return back to normal. So that's called the recovery period. The one on the left with stressor 1 is kind of a normal recovery period. It spikes and then it fairly quickly goes back to normal. But you can have slow recovery from a stressor if you are ruminating or thinking about the stressful event. So if you just had a fight and then you continue to ruminate about it, your blood pressure may take longer to go back to normal. And this has been shown in multiple lab studies. You can also ruminate later about stressor number 1, and that might have been earlier in the day, or it could have been a month ago. There, again, are lab studies showing that ruminating about something that happened weeks ago can cause a spike in blood pressure that was not associated with the original response. You can also have a blood pressure kind of reaction to stressful events before they occur. So when you're anticipating a stressor, if you're getting ready to give a presentation or you're worried about something that's going to happen next week, you can have stress responses then. And this is the real, this one is unfortunate. There are blood pressure responses to worrying about stressors that will never happen. So people are worrying about some possible stressful event in the future that doesn't happen. And so that's also having an impact on the body. So how do we break out of that cycle? That rumination is kind of helping to understand the link between perceived stress and these emotional, behavioral, and physiological effects, and how a stressful event can become chronic. And so breaking that link somehow has to operate on the perceived stress box here. And so we're going to talk about mindfulness training and how mindfulness training will not only increase mindfulness, of course, but decrease rumination. And in that way is one way potentially to break this cycle. So what is mindfulness? The kind of most commonly accepted definition is shown here. So it's defined as a non-judgmental awareness of present moment experiences, including thoughts, emotions, and bodily sensations. And that's kind of a mouthful, but the words I highlighted are the 3 key dimensions: non-judgment, awareness, and present moment. This figure is often shown in mindfulness materials and programs to kind of make the point that, there are 2 different ways to go through your day, where your mind is full of thinking about things that are not happening to you in that present moment, or you can be in the present moment, like the dog on the right, and really just be aware of what's going on around you at that time. So the present moment, and this is another way to make this point. Your body is always in the present, but your mind often isn't. Your mind is often in the past or the future, and that brings in those things we talked about, rumination and worry. And that is what mindfulness is going to try to address. The awareness and non-judgment piece, again, gets back to this model linking the stressful events and the stressful reactions. So mindfulness is kind of operating on this observation that many of our reactions to stressful events feel like they happen automatically. Often we're not even aware of it. So you find yourself feeling upset, and you may not always know what the trigger was. To change that pattern, we have to obviously become aware of the thoughts, the feelings, and the sensations that make up our personal stress reactions, and everyone's are different. And so meditation and developing mindfulness fosters an awareness and acceptance of thoughts and emotions, including negative ones, as non-threatening temporary experiences. So the idea here is that negative thoughts, which are really kind of at the center of this whole model, will often go away without us trying to get rid of them. People sometimes think that mindfulness is about getting rid of negative thoughts or clearing your mind. And that's not really what it is. It's about being aware that you're having negative thoughts and accepting them, and accepting that, understanding that they will go away on their own. There's lots of kind of visual images used in mindfulness training programs, like, a leaf floating down a river, or a cloud floating across the sky. They're kind of, trying to show us that if we step back and just observe what's happening, you can kind of disconnect some of the physical and emotional reactions to the thoughts and the events themselves. The other key point that mindfulness programs make is that thoughts are not facts. So we are often allowing our bodies and minds to get hijacked by these thoughts that may or may not be true. A lot of thoughts are, in fact, interpretations of events, where we may be wrong, we may misunderstand, and trying to be aware that we are going through that process is the first step to breaking that cycle. So how do you learn mindfulness? I think, many more people are familiar with it now than when I started doing research on it. So that makes my job a lot easier. But just to go through some of the basics, the main way to learn mindfulness is through practicing meditation. And this is probably what people typically think of, these formal practices. So guided body scans or sitting meditations of varying lengths can help to train the mind to pay attention to the present moment. Often in most of these practices, the breath is used as an anchor. And so you're, sitting in a position and trying and focusing on your breath, and inevitably you will notice that your mind has wandered off and you forgot that you were trying to meditate. And the key to this practice is redirecting your attention back to the breath. It is 100% normal and expected and inevitable that your mind will wander. And it is the repeated process of redirecting attention back to the breath that we think is responsible for some of the brain changes I will show later, that result from meditation and mindfulness training. And so that is a really important part of learning mindfulness. But also important is what we call informal practice. So this is bringing focused attention to your routine activities in daily life. So you can do basically anything mindfully. You can brush your teeth mindfully. You can eat mindfully. And some of those types of examples are used in mindfulness training programs to help people understand that, most of the things you do can be done focused on the present moment, so that you are really experiencing that activity and not in autopilot, doing one thing but thinking about another. So does it help? The picture on the left is just this evidence, like as I mentioned, of this really dramatic increase in interest in mindfulness over the last decade and maybe more. Where, again, when I started this, we had a lot of pushback sometimes from participants in our research studies who didn't know what it was, didn't understand it, and thought it sounded really weird. But mindfulness is becoming really accepted, and that's both in kind of the popular culture and also in the scientific literature. I'm showing here just a statement from several years ago from the American Heart Association about meditation and cardiovascular risk reduction. And I think the theme of there are many of these types of papers, and the theme is that basically there is a lot of growing promising evidence that meditation can improve, whether it's cardiovascular outcomes or other health outcomes, but we need better research. Many studies are small and have some methodological limitations that require kind of more investigation. Wanted to show just two examples from my own work. So I've been studying a program called Mindfulness-Based Cognitive Therapy that combines mindfulness training with cognitive behavioral therapy for different populations. And the graph on the left, is from a study of women with elevated blood pressure. And we found significant reductions in perceived stress and also in depressive symptoms, not shown here, after this 8-week mindfulness training program in that study. And then the study on the right was a study of Hispanic patients with epilepsy who had elevated depressive symptoms at baseline. They went through another mindfulness program called Uplift, also an 8-week group-based program. And you can see here that the solid line is the usual care, so no intervention, and the dotted line is the Uplift group. And what's on the left axis, the y-axis, is the percent of people who had clinically significant depressive symptoms. So the usual care arm, you can see, didn't have much change over the year of the study. And the Uplift group decreased pretty dramatically by 6 months. At that point, the difference was 40% versus 70% of people having clinically significant depression. And that rebounded a little bit at 12 months. But, it's important to note this was an 8-week intervention. So nothing happened after the 8 weeks, and there's still a reduction in depressive symptoms. There are also quite a few studies that have looked at effects of mindfulness interventions on blood pressure. This is one of the systematic reviews that kind of combined multiple studies. And basically, they concluded that there were significant effects with a moderately large effect size for systolic blood pressure. Diastolic is not shown, but is similar after completing a mindfulness intervention versus a control. So how could mindfulness interventions support healthy aging? It's, what I've shown so far is some effects on psychological outcomes, on blood pressure. And, a lot of these factors are shared risk factors for heart disease, for cognitive decline. And so that's one pathway. But this figure is kind of specifically focusing on aging, healthy aging. So we are hypothesizing that mindfulness interventions, by enhancing attentional control, preserving neural functioning, improving psychological well-being, and reducing inflammation in the body, could support healthy aging. One thing that's not shown here, and I'm not sure why, is the behavioral effects. So, there are studies showing that mindfulness improves sleep, and improving all these other factors like depression and anxiety and stress could lead to improvements in diet, physical activity, and other behaviors that are related to all these different health outcomes. So I will kind of wrap up by showing the emerging literature on what we know about mindfulness interventions and cognitive outcomes. This first study is a meta-analysis that synthesized 45 different studies, a total of more than 2,000 participants who had participated in either a mindfulness-based intervention or control, and they looked at effects on cognitive outcomes. Overall, they found small but significant benefits on overall cognition and executive function. And interestingly, the effects were stronger when they separated by age. They were stronger in studies of older adults, so 60 and over, compared with younger adults under 60. There's also recent evidence that mindfulness training could help maintain cognitive function in patients diagnosed with Alzheimer's disease. So this was a smaller study of 120 Spanish patients with AD treated with donepezil, and they compared 4 different groups. So there were 3 intervention groups, a mindfulness training group, cognitive stimulation therapy, progressive muscle relaxation, and then a control group who just had medication, but none of the interventions. And they looked at cognitive function over 2 years. And what you can see here, I know it's tough with these different shades of gray, but in both figures, the top line with the kind of medium gray and the diamond is the mindfulness group. And the black line with the X's is the control group. The other 2 are the other intervention conditions. And so what they found was that mindfulness was associated with maintenance of cognitive function in people with mild to moderate AD over time. So the 2 graphs are showing 2 different measures, the mini mental state exam and this other measure, which is another measure of cognitive impairment. And so that's what we want to see, kind of a stable line, if not an improvement. And the people with medication and no intervention had a much steeper decline in their cognitive function. There's also some emerging, again, small studies looking at effects of mindfulness-based interventions and the brain. So the first one shown here was a review of 13 studies that have tested effects of meditation on gray matter volume. And they included both participants with and without cognitive impairment. All the studies reported significant increases in gray matter volume in the meditators or the intervention groups in various brain regions. And very interestingly, they observed these benefits in both experienced and novice meditators. So it's not just the lifelong meditators who are showing this effect. A novice meditator was someone who hadn't had prior experience who went through a mindfulness training program. So it really kind of speaks to the idea that it's never too late to learn this skill. And several small trials have also shown positive changes after mindfulness training in inflammation, functional connectivity, and brain structure and function in regions that are known to be sensitive to aging and AD. So to kind of wrap up, hopefully what we've learned is that chronic stress increases the risk of developing cognitive impairment over time, but mindfulness and meditation may slow cognitive decline. Mindfulness interventions also improve stress, depression, inflammation, and behavioral risk factors, and that those may be some of the mechanisms by which they improve cognitive function. But again, this is an emerging literature. There are lots of limitations to the studies that have been done, and we need more research to understand the effects and the mechanisms. We also need to really understand the best ways to teach mindfulness to people. There are lots of different types of programs, and we don't know a lot about how best to tailor the programs to different groups. But I think I feel comfortable saying that, despite these limitations and the need for more work, there is probably no harm and lots of potential benefit to looking into mindfulness. And so I wanted to just end with some resources. If anyone is interested in learning more, there are some local New York City-based groups that all have Zoom-based, kind of remote options, and some have in-person options as well. And then some reading materials, books, workbooks, apps, websites, things like that. So I hope you find that helpful. And I will stop there and happy to take any questions.